They come from a multitude of different reasons. I'm actually a marriage family therapist, so I see a lot of people who come in because of difficulties with relationships, marriages that are struggling, children that are having trouble connecting with people at school or socially. Uh, I get a lot of it because I'm also a registered nurse. I get a lot of people referred for anxiety, depression, um, just the full gamut, but discomfort in their lives that's interfering with their ability to do their day-to-day functions. It's funny, when I was an intern many years ago, I had a supervisor that said that criticized one of my associates because he didn't want to work with children. And his comment was that anyone that can work with kids can work with adults, because inside of every one of us is a kid. One of the differences is that kids are much more open. They're more likely to change behaviors and experience. They're much more immediate and much less defended. The other difficulty, though, with working with children is that you often will create changes within the child, but the parents think they want the change, but it means they're having to change, and that can create resistance on the parents' part. Um, I think probably the biggest difference is their level of defendedness. You know, nature versus nurture has been a question that's been there forever. At one point they said that we were born tabula rasa, that we became strictly what our environment and the nurturing that we got. It's not true. I've learned, not only as a parent, but in working with clients, that we're born with a kind of a blueprint and a structure. We have an inborn temperament. It's funny, from birth, unless there's trauma, you'll know whether or not your child's going to be an introvert or an extrovert, because they're just wired differently. It's the nurture, so nature creates the framework, and then the nurturing, whether or not the child has been supported, given opportunity, uh, discipline, any trauma will then shape the exterior of that framework. I do a deep, a comprehensive history that's both developmental and social. One of the first things I ask them is why they think they're hurting, because although I've got lots of training and expertise, each of my patients are the best expert on themselves. But we look into family history. We look, interesting enough, if someone comes in with anxiety or depression, one of the first things I do, if they haven't been referred by a doctor, is to refer them for a physical, because sometimes emotional symptoms like anxiety or depression can actually have a physiological base. Once that's been ruled out, then we work to find out what is causing the symptoms. Part of it is when they tell me. So when they come in and feel like their symptoms are improving. Other things is when I see a decrease of repetitive behaviors. And probably the most important thing is when the patient starts to own what's going on instead of blame it on someone else. So when they are an active participant in making change, then you know you're making headway. One of the things I do is I acknowledge it. If we work together for a bit and we don't seem to be making progress, or if I will own that. Often just acknowledging that we're kind of stuck allows us to examine and maybe change a direction. Ethically, if I'm not making progress with a patient, I shouldn't be seeing them. And so I would offer them referrals. But before I did that, I might, something that I've done in the past is consult with a colleague for suggestions. So consultation, referral, or just reworking the roadmap. Seeing people progress and seeing the quality of their life improve. I know very much that I don't do that, but it's such an honor to be on their journey with them.
Mm-hmm.
And anytime one of your patients or clients grow, you kind of grow with them. You learn something. There was a philosopher by the name of Martin Buber, and he talked about a space called the between in a book called I and Thou. And anytime there's change on a deep level, when two people are working together, they both grow. I wish there were, and we're coming to a point where there's much less stigma. Therapy, I wish, could be seen as simply a tool that anyone can utilize when they find themselves in a stuck position. Much of what we do is teach problem solving, better communications, and just a way of being present. I think that if most of us were able to be less reactive to the people around us and more responsive, we'd be in a very different world.
Definitely.
Well, it's an interesting field, and it's a changing field. When I first went into therapy, the focus was on much more long-term therapy. Now the focus has become kind of regulated by insurance companies and by other outside entities, so the focus is much more short-term. So you work more on symptom relief sometimes than you do the problem underneath it. It's getting harder and harder to get reimbursed. So, because of managed care, it's not a field you go into to get rich. And the other piece is to remember that when you're sitting with a client, as much as you enjoy people, it's got to be about them, not you. It is a field that if you enjoy people, it's extremely rewarding.